this is a huge honor for me today to be podcast interviewing Radoslaw Yadach from Poland. And I think you are, not only are you one of the most handsome dentists I've ever seen in my life, with your look, I love your Fu Manchu and your bald head, but the dental cases that you post are world class. I mean, you do dental cases that I've never seen anything like it. I'm going to read your bio. You graduated from the Faculty of Medicine and Dentistry in Poland, Department of Emergency Medicine, University of, I can't say the name in Polish very good. It's spelled Wroclaw. I think it's Wroclaw. Department. What is?
It's Wrocław.
Okay, I won't even try that. I've lectured in your great country 3 times. And one of my very best friends is Marcin Dolecki. Do you know Marcin?
Yes.
Yeah, and you have had training in soft tissue in the prestigious centers in New York, Berlin, Stuttgart, Genoa. In 2009, began training at the University of New York, continuing education, Linhart dental program, NYU implant, continuing education, OSIS, and CEIA. Certified at New York University. You are a lecturer and trainer on symposiums, national and international conferences. His own practice focuses mainly on microsurgery techniques and extensive soft tissue reconstructive surgery for the purpose of alveolar implantology. As one of the first doctors in Poland, applied pre-orthodontic decoration procedure using piezoelectric devices, and first created a classification of anatomical indications for the treatment of maxillary sinus floor elevation with access to the hard palate. You have a private practice in Poland, the Dental Salon, and you're co-founder of the Oral Surgery Academy. But I have to tell you, in all seriousness, I've seen dental cases for, 30, 40 years, and yours are just world-class surgeries. The things you do, you literally look like Beethoven playing the piano. So thank you so much. I've posted some of your YouTube videos on Dental Town, and everybody just, some of those, I think I've posted 3 YouTube videos of yours. I hope someday you will create an online continuing education course. I think the 210,000 dentists on Dental Town would love to see your work. It's amazing. And people should follow you on Facebook. Your Facebook page, you're just always posting amazing cases. So thank you for joining me today. It's 9 o'clock in the morning in Phoenix. What time is it in Poland?
It's 5 p.m.
5 p.m. So you just finished your day?
No. I'm between patients.
Oh, wow. Well, I think it would be easier for you just to lecture because you have a friend of yours who's an interpreter. And I think instead of me asking questions to the interpreter, to you, to the interpreter, to me, you have great talking points, and I think you should just lecture. You're talking to probably, 7 to 10,000 dentists right now. 80% of them are in the United States, and 20% are in about 134 other countries. So I think you should just take it away. Just let her rip.
I'm with my friend because I want to feel safer with him. My English is not so fluently, so from time to time I will ask him for help, okay? So forgive me, but maybe it will be a little disturbing our talking, but I will feel safer with him.
Well, it's amazing that you can speak English. They say if you speak 2 languages, you're bilingual. If you speak 1 language, you're an American. And all my friends can only speak English unless they're Hispanic and they speak Spanish and English. So I couldn't imagine trying to talk to you in Polish. So all my listeners in America are just, they're amazed that you can speak English at all. So that's congratulations on that.
Thank you.
You talk about the 3 stages of knowledge. What do you mean by the 3 stages of knowledge?
Okay. First stage, I taught my students that these 3 stages. First stage is, I know everything. It is first stage. Second stage is, I know nothing. I know that I know nothing. And third stage is, okay, today I know what I don't know. So after study, after university, the young doctors are in first stage. They think that they know everything. And I want to make shock in their heads that for showing them that there is a lot to learn and there is a long way to be a good in this job. So after that, they should feel that they know nothing. This is second stage. And third stage is in jakiś taki dojrzały doktor?
Experienced doctor.
Experienced doctor should know what he doesn't know. What he should to learn more training, in which procedures he should be more work on it, because it's not so perfect. And in my opinion, there is 3 stages of knowledge.
I want to ask you, when I think of you, I think of amazing surgeries, amazing sinus lifts, amazing alveolar ridge buildup. When I talk to American dentists, half of them are afraid of surgery. They don't want to pull wisdom teeth. They don't want to place implants. And I always wonder, why did you become a dentist? I mean, when you work on the human body, it's all surgery. I mean, dentists, everything they do is with their hands. It's surgery. What would you tell someone who's listening to you right now, who's never placed an implant and says, I just want to do fillings and crowns? And when I look at Radoslaw, Yadach, YouTube videos, I mean, that's frightening. That's scary. How did you enter into surgery? Why do you like surgery? Why does it not scare you or bother you when you're playing with someone's sinus?
Maybe because I'm addicted from adrenaline, and I need adrenaline for my life, and it's a big pleasure to help people too, but I think it's too much for me be like a cardio surgery or neurosurgery when patients can die. I want to have a lot of time to prepare to the surgery, to prepare myself, to prepare patients, maybe consultation with other friends with bigger experience than me, and then when I've got a lot of information, all knowledge about this case, I can start the surgery. And I was working in a hospital for adrenaline, for more knowledge, and now I know that hospital is not for me. I like very much that term of my life. It was 12 years in hospital on the maxillofacial department in the emergency. I know how to use basic life support technique, advanced life support technique. So today I'm make courses for it for my employers, for my doctors, and I don't lose my mind when something dangerous happens with my patient. I know what I have to do. So I'm not panic, because I saw a lot of dangerous situation in hospital and emergency. So today I'm very easy and quiet when something's going wrong in my dental office, and I know how can I help. So that's why I was in a hospital for an emergency.
It was like having a remedy against stress.
And but surgery is when I'm doing surgery, I can't thinking about something else. My mind is clear and I'm thinking only about this case, about this patient. And my life problems, my problems with banks, with problems with friends, with families, problems disappeared. No, no problems. When I'm doing surgery, I feel peace and quiet. It's like after alcohol.
And you're Polish, so that would be vodka, right?
Yes, yes.
Hey, I want you to talk about sinus lifts. Your sinus lift cases that you do are amazing, and I'm 53, and I've seen different sinus techniques emerge over the last 3 decades. What is the state of a sinus lift today? There's many different ways to do a sinus lift. I know you like piezoelectric devices. Will you tell us about piezoelectric and sinus lifts, or just how you like to do sinus lifts?
I'm used to use the piezoelectric, but I think if I use the diamond drills or piezoelectric or SLA kit, special drills for approach to the sinus, it's not important what I'm using to make the osteotomy window. In my opinion, we forgot what we are doing during surgery. We should operate according to anatomy and physiology of tissues which we are cutting. So, in my opinion, it's more important than stuff. It's technique. Stuff doesn't mean technique. I can open window by nails, no problem. But the problem is how I prepare the flap, how I cut the periosteum, how I prepare my patient by pharmacology, why head should be higher than foot, how it make my surgery pole without blood, because when there is a blood, I can see what I'm doing. So the surgery should be clean and less traumatic than I can do. So from the other hand, if I speak with my friends, from time to time I see that they don't know what Schneiderian membrane is. It's not mucosa only and not periosteum only. This is a specific, Schneiderian membrane is very specific, and they don't know exactly anatomy of this place. And like Professor Al-Farah has said on the last Quintessence Symposium in Poland, he's an author of beautiful anatomic atlas for implantologists, that when you're doing sinus lift without CBCT scans, it is big mistake. But when we do the CBT scans, it doesn't mean that we know everything about the sinus. So we should cooperate with laryngologists, prepare that sinus before surgery. We should know what we have to do when the complication is during surgery. And so we should thinking what we want to do when we will be on the place on the dental unit. So I'm trying to think like patient. So patient wants to do everything in one stage if it's possible. So if I tear the Schneiderian membrane, so I have to think, I have to learn how to finish the sinus lift in one stage mimo że,
Despite
I tear the Schneiderian membrane. So we know two ways. One way, I tear the Schneiderian membrane and make collagen membrane and finish sinus lift, or close the sinus, wait a few months, and waiting to regrow the new mucosa into sinus, and start again the sinus lift. But when I bought the volumetric tomography into my clinic, and I see more structures, anatomic structures. So that's why I create the anatomical classification for best approach for some anatomic situations. So when we should thinking about atrium approach, when we should thinking about palatal approach or crestal approach, and I sent the article with Professor Giulio Rasperini to the Journal of Restorative and Periodontal Dentistry, and we are waiting for acceptation of this article, and I think it will be very interesting for our listeners and friends.
Is there any way we could get that as an online course on Dentaltown, where you could actually show PowerPoint or videos?
Yes.
I think it would be the most broadly watched platform, because there's 210,000 dentists on Dentaltown, 40,000 downloaded the Dentaltown app on their smartphone, and they can watch those online CE courses on their Android phone, on their iPhone, and I think that you are the master of these sinus lifts, and that would be a mind-blowing presentation.
I'm ready to do it.
Oh, that you just made my day. You made my day. So can you go into more detail about sinus lifts? Are you using, what type of bone are you using when you do a sinus lift?
Usually is it xenograft, bovine bone.
Bovine bone.
Bovine bone, yes. But from time to time, when I see that the plate of cortical plate, there is only cortical plate. There is no spongious bone. So I can think that there is no enough osteoblast to create new bone. So we have got two ways. One way is waiting. I put only xenograft and wait 1 year before implantation, or I mix the xenograft with autogenous spongious bone taken from chin or retromolar area. So I'm not. I haven't got experience with allografts. In Poland, this is something new. We import the allo bone from Austria bone bank, and we are learn of it. But I think the next interesting thing is that if we've got only cortical plate, there is one big sinus and around is only cortical plate. It doesn't mean we can't do the implantation simultaneously. We can do this, and I can show you the two ways how we can do sinus lift and implantation. It not depends on the system of implant. We can put implant in the same time, only where is it only half millimeter plate or cortical plate, and we can put implants there. But I, like you, maybe you know, but I'm not showing all of my cases on the Facebook or other internet ways because I want to show something more on the courses. So maybe on the Dental Town when will be webinar about sinus lift, I can show this.
I would love to see that. I've also noticed in the last I got out of school in 1987, and it seemed like everybody wanted the implant to be the longest. And now it looks like in 2016 that length doesn't matter as much as width and fat. Are you using shorter, fatter wider implants in the sinus region? Is that more of a trend that you see, or are you still trying to get length?
Very good question. No, there's a lot of factors when I'm taking to make the decision how long implant I will use. So if I can use shorter implant without sinus lift, I will choose that way because it's better for patient. It's more cheaper, less invasive, and in my opinion, it is better for my patient. If I can, and it's faster, I will operate shorter, so I can take 2 patients during 2 hours, not 1 patient during 2 hours. So, but from time to time, there is other factors. For example, prosthetic factors. If we've got the bone lesion, bone defect, crestal defect, when I have to create longer crowns, you know, there is a horizontal defect. So I have to ask my patient, do you want longer teeth? Because in medicine we've got pluses and minuses. So
advantages and disadvantages.
Oh, advantages and disadvantages. And from time to time, men said, oh, crowns could be longer or not. It's not important for me. I want to bite only. But women said, no. These crowns should be same like on the other side. Because my smile is so wider, and I'm showing during smile my second molars. It should be perfect. So I should do the GBR technique to create more crestal, not go to the sinus. So it's the other factor. But shorter implants are very useful in the mandibula because mental nerve and mandibular nerve. So if I may put the shorter implant without complex surgery, complex GBR, do the nerve lateralization, I will choose shorter implant because it's better for my patient and less invasive. But it is danger for long-term results. For example, I see that, okay, between top of the crest and mandibular canal, I've got 15 millimeters only, but 3 millimeters of it is only cortical plate. So the short implant will not work because this cortical bone will not grow into the surface of the implant. So it will be taken only by 2 millimeters in spongus bone. So it is very important to do this CBCT scans and slices and examination of that bone when we will put the implant. From time to time I have to decorticate this crest and create new bone, spongus bone in that 3 millimeters and then put the short implant. So it's not easy to say short implants are always better than longer implants. No, but I'm against the putting the 15, 16 millimeters implant into the sinus because it's not important. It's not so important. If we put into the sinus more xenograft, there is a more possibility to contamination by non-oxygenic bacteria, because the blood will not go to the middle of this, to the centrum of this graft. You know, if I've got graft like this in sinus and like this, okay, so here will be wet and no blood. In blood are antibiotics and other cell factors which is give us the regeneration, give us the safety against bacteria, and there will be centrum of starting the inflammation. So we should put enough xenograft for implants like 10 or 11 millimeters. It's enough, really, it's enough. And when we elevate the membrane, Schneiderian membrane, we should remember about complex of hiatus maxillaris, connection between nose and sinus. It should be
it should be open.
It should be open. The sinus should be connected very well with nose, because if it's not connected, when there is edema of the mucosa inside, we can expect the inflammation after sinus lift procedures. So when we do only sextant CBCT scans, little pole is not enough to say, okay, I can do the sinus lift here. We should make more and healthy side on the second side to compare why that sinus is in good condition and that one is in wrong condition, bad condition. Why? And in my opinion, a lot of complications during sinus lift is because our patients were bad diagnosis before surgery. Today, I don't remember when I've got problem with sinus after sinus lift procedure, but I remember that it's because my friend Dr. Hubert Kubica from Poland, and he told me that the sinus should be very well connected with nose. Make more CBCT scans to see that structure. We call it in anatomical hiatus maxillaris. It should be open very well. If the teeth should be healthy, which they are nearby the sinus, should be healthy. So there is a lot of factors we should know and examine them before surgery, and after that we can make safe surgery for our patients. Money is not correct way to money is on the second or third place. First place is the safety of our patients. If they are safe, if they are happy, we will be happy too.
A lot of people like yourself who are taking CBCTs and doing sinus lifts, a lot of people are noticing that a lot of patients have failing root canals that had been failing for a long time, and the sinuses are infected, and nobody ever knew it. The dentist didn't know it. The patient didn't know it. Do you see a lot of chronic failing maxillary root canals that have infected the sinus, and the patient might think they've had sinus problems or allergies or other things, when in fact it's really a root canal that's been chronically failing for a long time and no one was aware of it. Do you ever see that?
Yes, a lot of. A lot of. I'm during cooperation with laryngologists from my town and from Poland, from my country, and they are treating the sinuses, frontal sinus, ethmoidal sinuses, maxillary sinuses, and is treated again, treated, and there is still inflammation, and after 2 years of treatment, they asking themselves, why? After 2 years, why? Maybe it's a teeth. So send these patients to the dentist, and what dentist should do? Dentist should do, okay, I'm dentist, but I'm prosthetic. Go to the surgeon or dental surgeon. They know more than me. No, the prosthetics will make the OPG only and write everything is correct with this. Bye. Is not good way. From the other hand, inflammatory in sinuses, because this is one problem, of course, but the other problem is that in general problem with kidneys, before transplantation of kidneys, before transplantation of
marrow, bone marrow,
bone marrow, because leukemia, for example, we should do always CBCT scans, not OPG only, to see is there any little inflammation because of tooth. If yes, we should remove it, not treat it, remove it, because we can replace the teeth, but we can't replace the heart, lungs, kidneys, and marrow stem. So in my opinion, it is a big mistake when we write to the transplantologist, everything with this is okay. I see this only on OPG. OPG is not enough.
What is OPG?
It's a panoramic X-ray.
Oh, okay, a pano.
Yeah. So what else? After old canal treatment with endometazone, for example, I can see a lot of aspergillus in sinuses. It's a form of the fungi, fungus inflammation. So if there is a fungus with names is aspergillosis, exactly the aspergillosis, we should think about very radical cleaning of the sinus. It is a procedure. Cardwell look procedure should be done because of aspergillus. And if patient has got Caldwell look 2 years ago and come to our dental office and wants implants and sinus lift, we should ask him if there was any surgery in sinuses, yes or not. If yes, what kind of? If it was Caldwell look, we can expect some problems with scar tissues inside, which is very, very difficult to disconnect with bone. So, for example, close technique is not recommended then. Close technique after surgery in sinus is not recommended in my opinion. We should open, like Professor Stephen Wallace from New York said, if there is as bigger problem you've got in sinus, you should open wider to see what is there, not by a little window. So I can say about, I can talk about sinuses few days if you want.
Keep going. I love it. Just keep going. I love it. You also said GBR twice, and a lot of listeners might not know what GBR means. Can you explain GBR?
It is a guided bone regeneration.
Okay.
It's a GBR, guided bone regeneration. So we can say about GBR when we use the collagen membrane. And GBR means that, for example, bone is growing 1 millimeter per month, but soft tissue grows 1 millimeter per day. So it's faster than bone. So we should disconnect this tissue from the bone, because soft tissue will grow into the bone defect faster than new bone. So that's why we call it guided bone generation. We guide that the soft tissue should heal alone and bone should heal alone. So this is GBR. But this GBR doesn't mean augmentation. Augmentation is the other procedure. So, for example, we've got the cyst inside the bone. Okay? If we do the cystectomy and remove it and send it to the histopathological examination, we can do two things. First, we can refill this bone defect by xenograft, allograft, autograft, no problem. But we can fill it. So if we do only fill it by some graft, it is augmentation. So it's an increase of the volume. It is augmentation. Augmentation means I increase the volume of soft tissue, volume of bone, no problem. But I can not put the xenograft, autograft, allograft. I can leave it empty. But on the osteotomic window, through this osteotomic window to the cyst, it was my approach to remove the cyst. This is osteotomic window. I can close by collagen membrane. So soft tissue will not grow into the bone, so there will be empty space, which will be healing by bone. And this is guided bone regeneration without augmentation. Okay? So it is explanation in my way.
I want you to weigh in on something very controversial in the United States. Some dentists will not place an implant or a sinus lift on a smoker. Other implantologists will. Will you talk about smoking? If a patient comes in and they smoke a pack a day, do you refuse treatment, or do you? What are your thoughts on a patient who's a pack a day smoker, 20 cigarettes a day?
I'm doing sinus lift to the patients which are smokers. It's not problem for me. Bigger problem is alcoholic patients.
Really?
Really? Why? Because the smoke between my graft and smoke is Schneiderian membrane and collagen membrane. So they will never nie spotkają się.
They will never meet.
They will never meet each other. Okay, I know that smoke is a big factor for oncology problems. Okay, I agree. The smoke is not only nicotine, but 40 other, it was a whole table of Mendeleev. But smoke will do anemization of the Schneiderian membrane, and from time to time, where the Schneiderian membrane is anemized, we can expect that the healing of this wound will be slower in smoker person than non-smoker person. But this is one problem only, in my opinion. Why alcoholic patients are, in my opinion, are more dangerous for our results? Because alcohol is in blood. So this alcohol penetrates my graft. So, and I know that my graft will be stabilized by blood clot. Blood clot will change into the fibrins, you know, there will be, some nitki, fibryny, nitki.
Fibers of fibrin?
Fibers of the fibrin, okay, they will be create, and osteoblast is a moving cell. And this osteoblast should be moving on the fibrin. So, if we know it, that alcohol paralyzes the
ability to work.
Ability to movement of the osteoblast, so I can expect that in alcoholic patients there can be no bone, or this bone will be very, very poor. I've got one patient with von Willebrand disease. If you know what is it, von Willebrand disease, it's brak czynnika.
Lack of a factor.
Yes, lack of 8 factor in blood. And I've got 3 times implantation in sinus in that patient. And 3 failures. It was a big problem. And I'm starting reading about von Willebrand disease. And there is a problem with fibrin. They will not create fibrin, they will not create blood clot. So, we put the 8 factor into the veins, and we've got 2 hours to do surgery safe. Okay, but the fibrin is created after these 2 hours, and osteoblasts grow into after these 2 hours. So now today I know that maybe it's interesting, but it's not in literature. If we've got the patient with von Willebrand disease, we should be very, very careful with sinus lift or GBR procedures. Because in this patient, I put 4 implants in other places, but into the natural bone. It was enough bone, and I put the implant. And every implant is working well. But that one in first molar, when was the sinus lift procedure, disappeared. So I've got only one case like that. So I can't do the 100 patients like that one, because it's very rare disease. Von Willebrand disease is very rare. So I can improve that. I want to speak with somebody who maybe knows more about von Willebrand disease, and maybe with orthopedic surgeon, maybe they know something more about this. So it's very, very, very interesting topic, and today this patient is my friend, and we'll talk a lot about this. So smokers, in my opinion, is not problem. I can say about one patient. We have planned 2 sinuses in one time, and I told him, okay, we finished right sinus, now we will prepare to do the left sinus, and he, okay, 1 minute break, I have to go to the toilet. It was December, 30 degrees under 0, and I'm waiting for him, and I'm looking through the window, and he's in front of my window and smoking. And and everything is working well 5 years till today. But what can I say? I see that patients who smokes THC, you know, grass.
Marijuana.
Yes, marijuana. They heal very well, with no problems. So this is medicament too.
So you're having you're having the most problem with not marijuana or cigarettes, but actually alcohol, alcoholics.
Yes.
And I'd like to remind everybody, you know who my first sinus lift, who I did my first sinus lift on? My mother-in-law. Isn't that what mother-in-laws are for?
Wow.
She was so sweet. She didn't care.
You're very brave.
You are very brave.
Hey, I want to ask you another question we get a lot. If you go to Cologne, Germany, at the big IDF meeting, there's 275 different implant companies. In your mind, are they all the same? Are there different? Is titanium, or do you like certain implant systems better than others? Because how does an individual pick between 275 different systems?
Very good question, Howard. In my opinion, I can say like Professor Weber from Germany. This system is very good, which works very good in your hands. It's the first rule. Second rule, it's not matter what kind of implant I will put into the bone. I can put this into the bone. But patients come to my dental office not for implant, but for crowns, for teeth. So, if I will choose the implant system, I will not looking for the surgery guide, but show me your catalog of prosthetic solutions. If I can use CAD-CAMs, individual solutions, individual fillings, individual abutments, bridges, show me what I can do in prosthetic on this system. And third factor is the service of the company, which will care about me and my patients. For example, I don't want to say what company supports me, but I've got 11 companies of implants in my dental clinic, 11. Because from time to time, this company has got problem with import. This company has got problem with stock. So it doesn't mean I have to stop implantation because they have got problem with stock. So I always have got plan B, C, D, because my patient will not work, will not wait for me, and he goes to the jaka jest konkurencja?
To my competition.
To my competition. To my friends, to the other dental officers. So today I can say that I can say about some companies that they are the best. There is no the best company. I choose the company which are 2 kilometers from my dental clinic. And when in Sunday everything is closed and patients from the England come to my office and say, okay, doctor, I'm here only 2 days, do something today. And there will be 16 implants, and it's huge money and huge work, okay? And I see into my magazine, I've got only 10 implants. I need 6 more. So I make phone to my company, and they open for me the stock, put it into the taxi, and this taxi bring it to me after 20 minutes. So this company is very good for me. And today I can put all implants into the bone with good success. But the third factor is how tight the elements will fit. Okay? Because we know that cone solutions, or like in 3i biomet, there is no cone, but it's very tight, there is a less space than bacteria is. Okay? So this is important for me. But Professor Markus Kerteler said, I got no problems with bone resorption around the platform. Why? Because I'm always put the implant, platform implant, supracrestal and create more soft tissue. So bone is safe because the platform is higher than crest. Okay, so if I know that, it's not important for me what kind of implant I will use.
So how do you attract patients from England to fly to Poland? Do you market dental tourism, or is it lower cost because of the difference in currency between the Polish money and the British pound, or is this just word of mouth referral? Are you advertising around Europe trying to get dental tourism? Is it people who just want to visit Poland? Talk about that.
Okay, so I make zero advertising. Zero. Jak jest poczta pantoflowa?
It's by the word of mouth.
Yes.
Word of mouth.
Yes, by the word from mouth to mouth. Okay? Okay, a lot of people from UK, it's Polish people which live there. Okay? But if they are happy after my surgery, they told about it for England friends. Okay, I will show you my town and you will make your new teeth. They've got the drills machines, milling machines, and they can do everything 3 days only and full smile, no problem. So, but I can see that in Poland we have got few doctors which are very, very good. You know them on the Facebook, and in Poland our dental clinics are very well equipped very well. We've got tomography, milling machines, we've got everything like on the whole world. So, and I can see that, and our government ma wysokie wymagania.
Has very high expectations.
High expectations for us, and make the ustawy,
Rules, acts of law.
Yes, our government create act of law with high expectations for Polish doctors. So we can say that our treatment is on the high level. So maybe it is interesting for patients too, but the price is on the second stage, is on the second place. Okay, but I can see something interesting. I'm do implantation for 3,000 zloty. $1 is a 4 zloty. Okay, so I put the implant for my patient. The price is 3,000 zloty. It's less than $1,000. Okay, but I buy the implant. When I buy the implant, the price for me is $250. It's quite more than you. So my price for implant is less, but my costs are higher than other countries. And in my opinion, it is very, very strange. Why?
Why don't you buy them from other countries?
Because the companies blocked They send me. We've got our distributor in your country, so why you want to buy from us? We can do this because we will kill our distributor in your country if you will buy from us. So this is a problem. So, but it's not difficult problem. So, okay, no, I will put more implants and no problem. I'm a little overworked with my friends, so this is the problem.
I want to ask you another controversial question. Some people who do sinus lifts think that you need to draw blood and spin blood and platelets and what have you, and other people say that that's not necessary at all. What do you draw patients' blood and spin the blood when you're mixing your bone grafting materials, or do you not find that necessary?
It's not necessary, in my opinion. We can see here about APRF, PRF, and other techniques. Okay, I'm read about it. I'm very carefully read what happened on the world about this technique. But what can I say? So why they have got same results like me without PRF? Okay, I've got same results or better, but it's not necessary to create higher stress for my patient to take the needle, put into the veins and grab the 400 milliliters from his veins. Why? For what? If I will feel like patient, I will afraid. Why dentist put something in my veins and take my blood? Why? He's only dentist. Okay? So it's not jak jest nie daje oczekiwanych rezultatów. To było wszystko takie.
So it doesn't give the expected results.
Okay. In my opinion, the future is stem cells. This is the future, and I've got few cases like that. There are I take the stem cells from iliac crest, and I can mix it, and stem cells are living 2.5 hours with, outside the organism. It's something, wow, it's perfect. And the stem cells can become tissue, tkanką, z którą sąsiaduje.
They can become a tissue with another tissue adjacent to it.
So this is something beautiful, like chameleon. Okay, I stay nearby the bone, I will be the bone. I stay nearby the gums, I will be the gums. So the stem cells, it is the future. PRF, okay, it's very interesting, but in my opinion, the more important thing is how do you operate. If you cut the soft tissue by pincette and push it, it can heal very well. You should take it very gently. Should be very gently. Your acids should be very gently. Your section tip, you have to have a 2 section tip. One section should be for saliva and only for saliva, and other tip only for blood into the wound. You can't mix it because bacteria will contaminate the wound. But nobody nie pamiętają, remember.
Nobody cares.
Nobody cares. And when they ask me why you have got so tak mało, so little inflammations, because I know the pharmacology, aseptic rules, everything, and if I do everything correct with these rules, it should correct healing. So, if young doctors ask me, okay, I want to start the PRF. Okay, I don't recommend it, but maybe I have not experience with it. Okay, but I don't recommend it. Why? Because I got same results or better than people who use the PRF. Maybe it's a very controversial word, but I think like that.
So we are out of time. I can't believe that was the fastest hour I've ever done a podcast. I think you are amazing. I am so hoping that you will create a continuing education course on Dental Town. I think thousands of people will watch it around the world. But I got to ask you a Polish trivia question. Do you know what city around the world outside of Poland has the most Polish people outside of Poland?
Los Angeles.
Nope.
I don't know.
It's Chicago.
Really?
Chicago has 1 million Polish people, and there are parts of Chicago where you think you're in Poland. I mean, I've been to Poland 3 times, and there are areas of Chicago where all the signs are Polish, all the people are Polish, and if you want to, there's over 1 million Polish people. If you want to eat the best Polish food in the world outside of Poland, you have to go to Chicago. It is truly amazing. But I just want to say that I thought the Chopin Museum in Warsaw was one of the most amazing. He was. I always like Chopin more than Beethoven or anybody else. I love your country. I love your people. I love Marcin Dolecki. Will you tell him I said hello?
Yes.
Yeah, and tell him that he should do a podcast on chirodontics, where he's mixing chiropractic care with dentistry. I think he's an amazing man too. But thank you so much for spending an hour with me. I really appreciate it. I think your work is world class. I've seen cases that you've done that I don't think anybody compares to it. So thank you for all that you've done for dentistry, and we really look forward to a course from you on Dental Town. That would be world class.
Thank you, Howard. Thank you, listeners and people there. It was great honor for me to be with you, and I really appreciate your invitation, and it's very important for me. Thank you, Howard.
Have a great day, and I hope to have a drink with you in Warsaw someday, in Poland someday.
I will prepare the great vodka for you.
Okay, thank you.